From the JAMA Network, this is JAMA Internal Medicine Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Internal Medicine.
Hello, and welcome to our listeners around the world. You're listening to JAMA Internal Medicine Author Interviews. I'm Dr. Nathan Stahl, and I'm an editorial fellow at JAMA Internal Medicine and guest host of today's podcast. Thanks for joining us. Today we'll be discussing a study that describes recent trends in U.S. sports betting and online searches for gambling addiction. I'm joined today by Dr. John Ayers, who is the senior author of this study. Dr. Ayers is the Deputy Director of Informatics at the Altman Clinical and Translational Research Institute at UC San Diego. Dr. Ayers, welcome to the podcast.
Thank you for having me.
I wonder if you could start by explaining how the 2018 Murphy versus National Collegiate Athletic Association, or NCAA, decision changed sports betting in the United States.
The important thing to note here is that the growth in sports betting wasn't legislative. It was driven by a court decision. So previously, Congress had outlawed sports betting, except for in one state, Nevada. And the Supreme Court said, well, no, we can no longer do that, due to pressure by DraftKings and fantasy sports, etc. And as a result, all states are now empowered to legalize sports betting. And since that time in 2018, sports betting has been legalized from one state to now 38 states across the country.
What has it done not just to the number of states where there's legalized sports betting, but in terms of the volume or amount of dollars of sports betting that we're seeing across the country?
In 2017, when sports betting was only allowed in Nevada, there was about $5 billion in total sports bets placed. Fast forward to today, and the latest available data in 2023, there was about $120 billion in wagers placed. And nearly all of those wagers were placed online rather than in the physical casino. People can sit on their couch at home, watch the game, place a bet. And it's not just a bet on who will win or lose, it's bets on every detail of the game, including parlay bets, these multifaceted bets that you can make that where one bet is contingent on the other. Those now represent the vast majority of all bets placed, and they're sure losers. But I was at the golf course one day, and one of the cart boys was like, "Hey, John, can I borrow $500? And I'm thinking like, oh man, you have the dream job, right? You get tips from rich people. How do you have money problems when you're 16 years old? He tells me like, hey, I messed up on my betting last week. And I'm like, you're betting? And it turns out he's betting all his savings on sports, something he shouldn't be allowed to do with his age. Yet he's able to do it. And I took that instance of that one person. I said, what's happening here? And so we went to the National Gambling Association website where they report these figures on how many states allow betting, how much is bet, in order to advertise the growth of their industry. And when I saw that data that we shared in our study, I saw a problem. And when I see that problem, I'm like, well, what's the public health implications of this, right? What's this mean for society? And when I looked into it, I'm like, there's nothing there. Even though, gambling addiction is in the DSM-5, it's a recognized disorder, it doesn't get the fair attention it deserves because it's always been something confined, to the fringes of society, right? You had to go to a casino to bet. Betting was largely restricted to places like Nevada, Atlantic City, tribal casinos. You just didn't think about it as being some normal part of everyday society. And so therefore, we didn't have the infrastructure to understand what are the public health implications of sports books. And we didn't have surveillance to know what was happening. And so for that reason, we turned to internet search queries, where you can see what people are thinking and when they're thinking about what they search online. And when you see that, you can see searches for gambling, addiction, help seeking are shattering all records. And since the legalization of sports books, they're up nationally about 23%. But we can look at specific states and go, when do they actually implement a sports book in that state? And we can see the opening of a sports book in a state drives an immediate increase in searches for gambling addiction. And that increase is sustained. And not only that, we can see, for example, in a state like Pennsylvania, where they legalized both online and brick and mortar sports books. When they opened their first brick and mortar sports books, I think queries went up about 33% for gambling addiction and help seeking. But then when they opened online sports books, it went up multiples of that. I think it went up about 70%. And so you can see this dose response effect. Not only the availability of sports books, but the availability of sports books on your phone is driving demand for help seeking. And unfortunately, that's the insights we have today, is to use search queries to understand how people are potentially hurting and who out there is actually seeking help. But it's in the millions. I would say nationally, since the Supreme Court Murphy versus NCAA decision, the number of searches for gambling addiction help seeking are around 6 to 7.5 million people searching for these problems since the entire 5 year period.
Based on what you found, this massive rise in the use of online sports betting, the massive rise in the number of bets being placed, and the massive rise that has been seen with internet searches for help seeking behavior for gambling addictions, what can we do to mitigate the harms of engaging in sports betting?
Unfortunately, you asked what can we do, and there's complexity to that decision. Like, we need to do more to equip healthcare providers with training in order to recognize the signs and problems of gambling, in order to intervene. Right now, a lot of our interventions, at least pharmaceutical interventions, are off-label. They've been designed for one addiction, and they're being applied here. And there's some complexity there. But I think from a public health policy standpoint, there's not very much complexity, right? There's an absence of any common sense regulations because a Supreme Court case is what legalized sports books, or empowered states to then go legalize it. And therefore, rule makers, legislators, the Congress have been sitting on the sideline and not implementing any common sense rules. And we don't have to look very far to see those common sense rules. We can look to tobacco or opiates or alcohol to understand, like, maybe there should be restrictions on advertising and who advertising can target. Should there be warnings? And do those warning labels then link people to evidence-based resources? Should we regulate the way that online betting happens? Like, you can't use a credit card and you can't have continual access to online betting. Should we regulate the types of bets that are placed? In absence of this, we're causing real-world harm. There's now been some evidence about the examples of that harm through court cases where litigation is occurring against the sports books themselves. And there's a case out of Illinois, for example, where a father who had a very good job, making, I think, like $170,000 a year, he liquidated his entire life savings, even though he'd never placed a bet before, in a matter of months. And during that time, his selected sports books was DraftKings. They would call him constantly every day and encourage him to place more and more bets. And when he started placing bets with a credit card, they coached him on how to apply for other credit cards so he could place even more bets. Also, in that court case and other court cases, for example, not only did they prey on losers, but they refused to let winners play. If you win gambling on sports books, you're no longer allowed to gamble. They'll actually turn off the app. They'll say, we don't want any more bets from this user. Or they'll build in artificial delays or triggers into the app to make it seem like the app's failing. So you've almost been, to use a term from online censorship, ghosted or shadow banned, from using the app. And you don't realize, like, oh, well, it's because I'm a winner. And really, we just need to regulate this industry using these common sense principles. And if we don't, those harms I just told you about, where they ban winners and take advantage of losers and liquidate their life savings, those will continue to happen. And we don't have to look very far to see what the consequences are when we ignore harms are onto society. Just look at tobacco and opiates. So regulators, particularly Congress, can act now or wait until millions more are harmed unnecessarily. I think in the United States, we have a particular problem because it's been relegated to states to decide. And states don't have the infrastructure to think about these problems at scale. When you isolate it to the state, they just simply think, let's legalize it and not do much more. And that's actually exemplified in our study. We went and looked at legislation where states have legalized sports books, and only one state had specifically earmarked dollars from revenue from sports books to treat gambling addiction or those impacted by gambling addiction. That was Wyoming. And I think the earmark was for around $300,000. Yet these states make tens of millions, if not billions of dollars in revenue now over the time period that we've seen from sports books.
Yeah, and I think the parallels that you have drawn to problems like tobacco and opioid addiction, we're seeing this just in another form of addiction that is initially in the shadows, is initially to the benefit of individuals making money without necessarily putting that money back into some of the problem that they've created.
Yeah, most certainly they're not putting it back in. And that's one thing we can do with common sense reforms, right? Is require that to be put back in. Some of our listeners will be like, yeah, I like the Eagles minus 1.5, coming up in the Super Bowl that happened recently. Well, the reality is people may want to bet, but should they be betting in an environment where the dangers aren't explicitly informed to them, where they're taken advantage of, where the resources aren't available to have a safety net to protect them? You know, we don't like to think of public health as this nanny state, but the reality is public health exists to help people who are hurt. And who's responsible for most hurt? Ourselves. And so we want to create that safety net to prevent those harms and try to improve conditions for people with gambling. Now, other people will be like, well, John, it's just gambling. What's the better to matter? Well, you don't have to go far to think about what the health implications are of gambling. If you lose your money, then you're in a position where you don't have any of the resources that we know are predictive of longevity and improved health conditions. You lose that safety net. The impact here is going to be tremendous. We can use our early warning signs that we have here relating to internet searches, or we can wait to see more material harms and let people suffer. I hope that our listeners will think about, how do I talk to my patients about gambling and sports books? Should I be bringing this up? And how do I encourage them to think about this? Public health experts to think about, how do I encourage and develop regulations and policies and safety nets? For example, like with the 1-800-QUIT-NOW smoking hotline, that is a evidence-based hotline that's been demonstrated, proven, randomized controlled trials. I think the first one was by Shuhan Zhu in New England Journal of Medicine more than a decade ago. With gambling addiction, what resources out there exist? What's the evidence that they're effective? We really are existing in an evidence vacuum when it comes to the public health and healthcare implications of legalized sports books. I would hate to be someone that would suffer the harms of gambling and sports betting in that vacuum.
Thanks. You've really laid out a compelling case with your study, and I think the ability to use data in a creative way like this to detect problems at a public health level is fascinating, but I think tremendously important. And I think the conversations that will hopefully follow your research, and including some of the points we've touched on today, are really important to address an evolving sort of modern scourge of society with the proliferation of online betting and sports books.
Thank you so much. I hope our study does stir action. That's what we need here, is we need advocacy, both from a healthcare and a public health standpoint. And I think your listeners can provide that.
Well, thanks so much for joining us, Dr. Ayers. I'm Dr. Nathan Stahl. I have been speaking with Dr. John Ayers about his study reporting how sports betting in the United States has evolved since the Murphy versus NCAA decision of the U.S. Supreme Court, and the association this had with gambling, addiction, health seeking. You can find a link to the article in this episode's description. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.